scholars. We are honored by his continued support of the program and for his presence with us today. So as we say on Sunday morning, the next voice you will hear is Dr. Robert Smith.
Thank you, Dr. Beach. Just thank you so much for all of the work and effort that you brought to inaugurating this program, as well as what you bring to health care in Jackson and this country. Good afternoon, inaugural scholars. As Dr. Beach said, I'm Dr. Smith, and unfortunately I've had to meet you virtually in 2020 because of the COVID-19 pandemic. This in itself is a very fascinating time to have joined a research program, and particularly one geared toward the COVID crisis. As you know, the COVID-19 pandemic crisis has virtually shaken the world from a health and economic point of view. As Dr. Beach mentioned to you, I have more than 50 years as a primary care physician, and have had an opportunity not only to wear a hat as a primary care physician, but the opportunity to be involved in making and shaping public policy, medical education, research, and involved in authoring more than a dozen programs designed to improve the quality of all of our lives. More than 50 years ago, I was able to bring together a group who was involved in research in direct health care and in the community health center movement, along with Jack Geiger and countless others that brought to bear major changes in healthcare that, in addition to addressing primary healthcare, address the social determinants of healthcare, initially with two centers, one urban in Boston and the other one a rural center in Mount Bayou, Mississippi. As Dr. Beach mentioned to you, the hats I've worn are many. One as a founding member of the Department of Family Medicine at UMMC. I was also co-principal investigator of arterial sclerosis in communities. We celebrated 30 years here at UMMC in 2017. We spun thousands of research papers and a number of other programs at UMMC, such as the Jackson Heart Study, for which we are part of, the Mind Center, in addition to being involved in research of these studies. I'm a personal participant myself, both in developing some papers and as a living participant. Let me congratulate you all this afternoon for joining the John D. Bauer School of Population Health, as you know, is designed to improve the health of individual populations and communities by enhancing healthcare systems and policies. The research that you have been involved in the last year in cardiovascular diseases has highlighted the importance of the school here at UMMC. But despite the fact that UMMC is one of the most prestigious medical schools in the Southeast, we still remain 47, 48, and 49 in healthcare morbidity statistics. This makes me again salute Dr. Beach, founding dean of the John D. Bauer School of Population Health and founding executive director of the Murray Evans Williams Institute for the Elimination of Health Disparities, who has transitioned from her role at UMMC on April 1, 2020 to an appointment as Associate Provost of Planning and the Strategic Initiative at the University of Houston. But she has remained committed, as you can see, to the Graduate Training and Education Center at UMMC. Naming this institute as the Burley Evans Williams Institute for the Elimination of Health Disparities. As you know, it's not only historical, but it's meaningful in a sense that she supported and worked with her late husband as he gave his life for all Mississippians to have a better quality of life. I am grateful to have worked with Meg out professional life and with 60 years. I wished I had an opportunity to tell you each individually about and hear about your you were the inaugural Robert Smith Scholars. And this program, which is again was started under Dr.